Well, we've been keeping a close eye on how Arkansas hospitals are faring as they try to bounce back from the challenges brought on by the pandemic. Rural hospitals still feel the impacts, and they're working to keep their doors open. New at 6 tonight, our Jalissa Garza shows us how and who is helping.
It's a long way from DeWitt to anywhere else.
Hospitals in rural areas like DeWitt are crucial in their communities.
Fully functioning radiology lab, respiratory, but the emergency room for the most part that's what's most important.
Since the pandemic, rural hospitals have been facing challenges, staffing and funding at the forefront. But CEO of DeWitt Hospital and Nursing Home, Brian Miller, says these problems were there long before the pandemic.
I got here in January of 2019 and they were in trouble. Honestly, they had already talked to the state about how to close the doors.
That year, Miller says they had to stop offering certain services.
We don't have surgeries anymore. We don't deliver babies. We're a very basic critical access hospital. So we had already crossed that road.
That decision, along with money brought in by the pandemic, helped keep their doors open. But that money is gone.
All of small hospitals in Arkansas have a decision to make at some point in the fairly near future.
Miller is part of the Arkansas Rural Health Partnership, an organization that supports 16 rural hospitals.
We're going to need to make sure that we keep health care in these small rural communities of some sort, and that we don't have many gaps.
Melly Bridewell says the focus right now is making sure all of the hospitals they serve are able to get more staff and money.
What funding opportunities are available, what resources are available, and bringing those to the hospitals.
Miller says they'll continue pushing through and are determined to keep their doors open.
Whether you call us a rural emergency hospital or a critical access hospital, we got to be here.
Jalissa Garza, THV 11 News.
The Rural Hospital Association says they're working to get more students in these rural areas interested in health care, and that would be a way to help with recruitment efforts.